head and neck anatomy for MRCS Part A, and this is very important for both Part A and Part B, because in Part B there will be direct two stations from this topic, and in Part A also minimum 10 to 12 questions we will get from head and neck, and from there this foramen is very important. So this is our preliminary picture what we studied in our MBBS level. Just we will have a gross idea, okay, about the anatomical location and their formation. This is a cross section of the skull, base of the skull, where we have different foramen and different structure. First of all, in the very beginning, we have something. You can see this is frontal crest. This is frontal crest, okay, and we have foramen cecum. Just behind foramen cecum, there will be a fragile plate-like. This is the cerviform plate. Okay, cerviform plate. And this is in which bone? This is the ethmoid bone. So together we say cerviform plate of ethmoid. Something like that. Okay. So again, we have frontal crest, then we have foramen cecum, then we have cerviform plate. And they have ethmoidal foramen. One is anterior, not one actually, in both sides too, right and left, and posterior. So ethmoidal foramen. None of these are important for exam. So no important. Next bone. This is optic canal. Very important. Optic canal. Optic canal. Optic canal. Just behind the optic canal, we have a process like
superior orbital
anterior conoid process. This is optic canal. Here we have anterior clinoid process. Anterior clinoid process. Important when we study about cilia turcica or pituitary fossa or pituitary gland, then this structure will come in relation. So optic canal, then just behind the optic canal there will be a bony prominence called anterior clinoid process, and just below the anterior clinoid process there is a big fissure, a big opening. This is superior orbital fissure. Okay, so optic canal, then we have superior clinoid process, then superior orbital fissure. Just below we have foramen rotundum. Foramen rotundum. So again, optic canal, superior orbital fissure, foramen rotundum. Okay. Foramen rotundum.
Yeah.
Then again, most posterior and lateral of foramen rotundum, we have oval shaped foramen called foramen ovale. Foramen ovale. Again, serially, optic canal, superior orbital portion.
Optic canal, superior orbital fissure, foramen rotundum, and foramen
ovale. Then we have foramen spinosum. Foramen spinosum. Okay. Foramen spinosum. Then here in the junction we have a lacerated part. Okay. It looks like lacerated, not smooth at the junction of two bones. This is foramen lacerum. Foramen lacerum. Then foramen lacerum. Then we had internal acoustic meatus. Internal acoustic meatus. Okay, this is internal acoustic meatus, and just below it we have big and very important jugular foramen. For the exam, if you forget everything and want to remember only one foramen, that is very important, jugular foramen. Then we have a big foramen. This is called foramen magnum. And lateral to foramen magnum, we have hypoglossal canal.
Yeah.
Just we got the idea.
Hypoglossal canal.
Once again, very rapidly you can repeat.
So we have optic canal, optic canal, supraorbital fissure. Then we have is the foramen rotundum, foramen ovale, foramen spinosum, foramen lacerum, internal spinosum, lacerum, internal acoustic meatus, and then hypoglossal canal.
Okay. And we have a big
And then
foramen.
foramen magnum and the jugular foramen.
We will read about their content. First comes foramen ovale. OVALE. From their name, OVALE. O for otic.
ALE. Otic ganglia.
V3. This V3 is the mandibular division of the trigeminal nerve. Cranial nerve number 5. We have olfactory, optic, oculomotor, trochlear, and trigeminal. Okay.
Trigeminal.
Trigeminal. Again. Hello, Dr. Sanjida. You can hear me?
Yeah. Sorry, you guys called me. I can pick up. I was at work. That's why I
No,
just came and just joined.
You can
Okay.
request very mostly. So now we are in the content of different foramen. First, we start with foramen ovale. Foramen ovale is the alphabet like O for otic ganglion, O for otic ganglion,
Yeah.
V for V3.
O for otic ganglion, V3, mandibular branch of the trigeminal nerve.
Trigeminal nerve, from the name, we can say it has 3 branches. Trigeminal means 3 geminal or 3 branch. What is the 3? It's actually 5th nerve. What is the name of the 5th nerve?
Ophthalmic, trigeminal nerve.
What is the?
Ophthalmic,
Can you name
maxillary,
12
and
cranial
mandibular.
nerve? Can you name that?
Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, vagus, glossopharyngeal, accessory, hypoglossal.
You just swiped 9 and 10. Vegas. Vegas is 10. Vegas is 10.
I knew.
Las Vegas.
Vegas is 10, yes. Sorry.
Vegas. Vegas is boss. I like Vegas now. Vegas has many important functions in our neck and chest and abdomen. So vagus nerve passes with which structure from chest to abdomen?
Diaphragm.
Which structure? Along with which structure?
Esophagus.
Yes, vagus esophagus. Vagus.
P10.
Yes, P10. So trigeminal, it has three main branches. One goes to upper part of the eye, that is ophthalmic zone. Then one part in the maxillary zone and one part in the mandibular division. So upper part, ophthalmic division is called V1, maxillary division is called V2, and mandibular division is called V3. Mandibular V3, ophthalmic, maxillary, mandibular V1, V2, V3.
Mandibular.
So from foramen ovale, we have V3, that is mandibular division of trigeminal nerve. O for otic ganglion, V3, mandibular division of the trigeminal.
Otic ganglion, trigeminal nerve. Yeah.
Then A for
accessory meningeal artery.
Accessory meningeal artery. And then we have lesser petrosal nerve and emissary vein. Accessory meningeal artery, very important. Accessory meningeal artery, lesser petrosal nerve and emissary vein. Then we have foramen spinosum. Remember where was the location of foramen spinosum? This was the foramen spinosum. Remember foramen spinosum, just big foramen ovale. So foramen ovale and foramen spinosum. Foramen spinosum, they contain two structures, MMA, MMN. MMN is middle meningeal artery, and MMN, meningeal branch of the mandibular nerve. Meningeal branch of the mandibular nerve. The previous one, P3, was the mandibular division of the trigeminal nerve.
Trigeminal nerve.
And this one is directly meningeal branch of the mandibular nerve. Separately, there is a mandibular nerve. Mandibular nerve, and it is giving branch to the meninges. So, meningeal branch of the mandibular nerve. They are going
Mandibular nerve.
spinosum. Now foramen
Mm-hmm.
rotundum. Rotundum contains V2. V2 is for
V2.
maxillary.
Maxillary.
Maxillary. Okay.
Mm.
Can you repeat this foramen ovale, spinosum, and rotundum?
Yeah, so foramen ovale is OVALE, aortic ganglion, V3, mandibular branch of the trigeminal nerve, accessory meningeal nerve, lesser petrosal, accessory meningeal artery, lesser petrosal nerve, and emissary vein. And rotundum contains only V2, which is the maxillary branch of the trigeminal nerve.
And foramen spinosum?
Foramen spinosum contain two things: middle meningeal artery and meningeal branch of the mandibular nerve.
Okay, very good. Now foramen lacerum. Foramen lacerum actually, they just contain two things related with the pterygoid canal. Nerve of the pterygoid canal and artery of the pterygoid canal. Very important. In exam also they ask internal carotid artery. They passes along its superior surface but does not traverse it. Means internal carotid artery will go superior to this canal. Suppose this is the canal. Internal carotid artery will go superior to this foramen lacerum, but they will not enter into the foramen. Okay, because for internal carotid artery we have carotid canal specifically. Okay, but foramen lacerum just
But
internal.
some of the literature they say, yeah, but some of the literature say that the foramen lacerum is same as the carotid canal.
No, okay, the traffic is joining. Okay, he is our senior. Okay, I'm accepting him. The traffic. Hello, I'm Dr. Asif Bhaiya. Can you hear me?
Yes, I can.
Okay, hi Bhaiya, welcome. Most welcome.
Thank you very much.
Yeah, we have Dr. Rajonia and Dr. Sanjita, both of them. They are rich people
Hello.
because they are staying in UK. We are poor people. We are living in poor country. Okay.
Hello, everyone.
Without
Wow.
tax.
Okay, Dr.
I will
Asif,
ask you once
I
you
want
come
to tell
here.
you, big brother, he is staying in Maldives and he is excellent
Is it nice?
in helping others.
Great.
Also, he is maintaining his surgical career. Very nice. Okay.
Thank you, Dr. Sudhanshu. Let's continue.
It's my pleasure to have you. Just we started with foramen of the skull. We have seen the location of different foramen and we have started with the content. First we have seen foramen ovale, foramen spinosum, foramen rotundum.
Yeah.
Now foramen lacerum. Foramen lacerum mainly we have nerve to pterygoid canal and we have artery to pterygoid canal. This is a tricky part. Exam they ask about which of the following is not a content of the foramen lacerum. They give internal carotid artery. So that will be the correct answer because internal carotid artery not traversing through the canal. It is just passing superior to this foramen lacerum, but not entering into the canal.
Okay.
Then optic canal.
All right.
Optic canal, very important. Optic canal from the name we can say they contain optic nerve,
Optic
and
nerve.
with this optic nerve it will be covered with its three layer of the dura. Three layer of the dura. Optic nerve with three layers of the dura. Okay, and because of this, if there is any infection in the meninges, we see the patient as papilloedema. Okay, meningitis patient may present as a papilloedema. Of course, they will have some other symptoms like neck stiffness, raised ICP, but in the eye, their feature will be papilloedema because of optic nerve is covered with the three layer of the dura. So optic canal, their content is optic nerve with three layers of the dura, then ophthalmic artery, this is the end artery, and sympathetic nerve. So three content mainly. Optic nerve, ophthalmic artery. Commonly we make the mistake here. Optic canal, we say randomly optic nerve, optic artery. There is no optic artery.
Yeah.
We have ophthalmic artery.
Ophthalmic.
Then we have
Yeah.
superior orbital fissure. very important, superior orbital fissure. If we remember serially, cranial nerves number 3, 4, 5 and 6. Dr. Sanjida, you can repeat the
5, no.
optic cranial nerves. What are the cranial nerves we have?
Olfactory, optic, oculomotor, trigeminal, trochlear,
Yes,
abducens,
trochlear number 4. Olfactory, optic, oculomotor, trochlear. Trochlear, then
trochlear, trigeminal,
trigeminal,
trigeminal, abducens,
abducens. Okay, up to here.
abducens,
So, yeah,
abducens.
up to here. Then we have oculomotor, trochlear, and abducens. These cranial nerve and cranial number 5. Cranial nerve 5 is trigeminal. Already we have seen trigeminal has its three branches V1, V2, and V3. V1 passes.
V3.
Yeah, we already got V2, which passes through foramen rotundum. Then we got V3, which passes
Rotundum.
through foramen ovale, and now we have
Foramen
V1.
ovale.
V1. This V1
V1.
is the ophthalmic division, and this ophthalmic also has different branches.
Yes.
In this picture, we can see ophthalmic has different branches like frontal, lacrimal, nasociliary. Okay, in this picture you can see.
Yeah.
Okay, so frontal, lacrimal, and nasociliary branches of the ophthalmic nerve, and
Ophthalmic nerve.
frontal, lacrimal, nasociliary. So I remember it like Palan, FLN, FLN. F for frontal, L for lacrimal, and N for nasociliary branches of the ophthalmic nerve.
Nasociliary.
Yes.
Ophthalmic nerve.
Then we have 3, 4, and 6. 3, 4, 6 is the oculomotor, trochlear, and abducens. They have different branches like superior and inferior division. So we combine together superior and inferior division of 3, 4, and 6. That is oculomotor, trochlear, and abducens. And through the optic canal, we have ophthalmic artery. So where there is ophthalmic artery, there must be ophthalmic vein, right? As we have ophthalmic artery, we have vein. This ophthalmic vein passes through superior orbital fissure. From either ophthalmic artery or ophthalmic vein, you will get one question. This is must question. So we have to remember ophthalmic artery goes with optic nerve, and ophthalmic vein goes with 3, 4, and 6 nerves. Now we have carotid canal. Very simple. Carotid canal, from the name carotid, we can say it contains carotid artery. Which carotid? Internal carotid artery. And where there is a big artery, they have their sympathetic plexus around it. Okay.
Yeah.
With any big artery, we have their sympathetic plexus. Okay, so carotid canal contains internal carotid artery and sympathetic plexus around internal carotid artery. Also, we have emissary vein. Okay, what is the importance of emissary vein? Emissary vein are valveless.
Sinuses, dural venous sinuses.
Yeah, normally veins have a valve, okay, which prevent backflow of blood. But emissary veins, they are valveless and they can easily transmit infection from outside of the skull to inside. That's why they are dangerous. Emissary veins. We will get it in part B. There is details about this. Now jugular foramen. Very important. Jugular foramen, they have like 3 segments. One is anterior, one is intermediate, one is posterior. So anterior, they have inferior petrosal sinus, and posterior we have sigmoid sinus, SS. So inferior
Sigmoid sinus
and sigmoid sinus. Okay. Inferior petrosal sinus, it is something like this, and sigmoid sinus also something like this, and they join together, and then they will internal jugular vein. Internal
jugular vein.
Again, anteriorly inferior petrosal sinus, posteriorly sigmoid sinus, and they join together to form
Sigmoid sinus. Yeah, internal jugular vein.
Internal jugular vein, and in between we have guava, guava. That is glossopharyngeal, vagus, and accessory.
Vagus and accessory.
Yes.
9, 10, 11.
Yeah, 9, 10, 11. 9, 10, 11. Then stylomastoid foramen. They contain stylomastoid artery and facial nerve. Stylomastoid foramen.
Facial nerve.
Then foramen magnum. Very important.
Stylomastoid artery.
Foramen
And
magnum.
medulla.
Mainly they contain
Medulla oblongata.
lower end of the medulla oblongata. Then spinal root of the accessory nerve. Main important. So lower end of the medulla oblongata and spinal root of the accessory nerve. Accessory nerve has two roots. One is cranial root, another one is spinal root. Okay, so spinal root of the accessory nerve remains in foramen magnum, also in the lower end of medulla oblongata. And we have vertebral artery. How many vertebral arteries? Okay, vertebral and anterior and posterior spinal artery. How many vertebral arteries we have? We have seen
The vertebra.
how many vertebral arteries?
Anterior and posterior.
Okay.
Anterior and posterior.
No, vertebral artery doesn't have anterior posterior.
12.
Vertebral artery is the branch of which artery? We will try to keep this right.
Oh, I know this.
No.
Oh my god, I know this.
Vitamin
I just read it.
C and D.
Yes,
So this
the
is
vitamin C and D. So this was
D
the
for
subclavian artery.
artery, yes. Subclavian artery. Subclavian artery, first branch is vertebral artery, right? So vertebral artery
Yes.
arises from subclavian artery in both sides. Right side we have right vertebral artery, left we have left vertebral artery. And these both vertebral artery join together to form basilar artery. We will see.
Basilar artery.
And we have spinal arteries. We have anterior spinal artery and posterior spinal artery. So all anterior, I think one anterior and two posterior spinal artery. Also we have vertebral artery. They all remain within the foramen magnum, along with lower end of the medulla oblongata and spinal root of the accessory nerve. Also there is a membrane,
Accessory nerve.
tectorial membrane and
Okay.
apical ligament of the dens. Tectorial membrane and apical ligament of the dens. So this is, from here you will get minimum 2 to 3 questions just from this chart. If you remember this chart,
Okay.
you will be able to answer 2 to 3 marks correctly. Again, very rapidly we will go through foramen ovale. What is the content of foramen ovale?
Foramen ovale. Optic ganglion. Optic ganglion. Oh my god. Optic ganglion, a V3 branch, mandibular branch of the trigeminal nerve.
What are the
Then
branches of the
accessory
trigeminal nerve? What are the 3 branches of the trigeminal nerve?
V1, V2, V3.
V1 is
Ophthalmic, maxillary, and
V2
mandibular.
mandibular, and V3 is V1 is ophthalmic,
V2 is maxillary.
maxillary, and V3
Maxillary. V3 is mandibular.
mandibular. Okay. Then Dr.
So
Sanjana.
V3, then accessory meningeal artery,
Yeah.
then lesser petrosal nerve, and emissary vein.
Sanjana, you can repeat. Content of foramen spinosum.
Foramen spinosum, middle meningeal artery, meningeal branch of mandibular nerve.
And foramen rotundum.
Is maxillary artery, like V3.
V3.
Maxillary
Foramen
artery.
lacerum.
Nerve of the pterygoid canal, artery of the pterygoid canal.
Okay. Internal carotid artery is a content of foramen lacerum. Yes or no? Internal carotid artery.
No, it's passed superiorly, passed along the superior surface.
Yeah. Okay. Yeah, you can answer. You can repeat. Superior orbital fissure. What are the content of optic canal? ভাইয়া কি কথা বলা যাবে? ভাইয়া আছেন? Optic canal content.
So optic canal is optic nerve with 3 layers of dura, ophthalmic artery, and sympathetic nerves.
Okay. And superior orbital fissure.
So superior orbital fissure is very interesting. So it has three ophthalmic branches: frontal, nasociliary, and lacrimal. Then it has oculomotor, superior and anterior and posterior division. Then it has
Superior
trochlear and
and,
apicens.
superior and inferior division
Superior
of
and inferior. Yeah,
3, 4, and 6.
of the oculomotor nerve. Then trochlear and apicens and ophthalmic vein.
Then let's consider carotid canal content.
Carotid canal, sympathetic plexus of the plexus for internal carotid artery, internal carotid artery, and emissary vein, deep petrosal nerve.
Okay. And jugular foramen.
Jugular foramen, anteriorly inferior petrosal sinus and posteriorly sigmoid sinus, in middle glossopharyngeal, vagus, and accessory nerve.
Okay. And foramen.
Stylomastoid artery and facial nerve.
And foramen magnum.
Foramen magnum, spinal, vertebral and anterior posterior spinal artery, spinal root of accessory nerve, and lower end of medulla oblongata. And
Pectoral membrane. And apical
pectoral
ligament.
and apical membrane. Yes.
Okay. Now again, same thing. Already we have finished, but it is more organized. See, according to their location. This is superior orbital fissure. You know what is the content of superior orbital fissure? 3, 4, 5, and 6.
Yeah.
5 which branch? 5 which branch? V1.
Ophthalmic. Yeah.
Ophthalmic. And V2 goes through which canal? Which foramen?
Spinous.
Foramen.
Rotundum.
Rotundum.
Rotundum. Sure.
V2,
Yes.
yeah.
And V3.
Ovale.
Ovate.
Foramen ovale. Okay. So you can see their anatomical location. Optic canal, superior orbital fissure. Then foramen. This is foramen ovale. Then foramen spinosum. This is foramen rotundum. Rotundum contain
V2.
V2. So see, serially also it is V1, V2, then V3. Right? V1 going through superior orbital fissure. Then V2
V2
going
rotundum and V3
rotundum, and V3
ovale.
ovale. Then foramen lacerum. Then this is jugular foramen, very important. Then stylomastoid foramen for internal acoustic meatus. It contains, we didn't read.
Vestibulocochlear nerve.
Yeah, stylomastoid foramen contains facial nerve
Stylomastoid artery, facial nerve.
artery. And here we have hypoglossal canal. It is not written there. Hypoglossal canal contains hypoglossal nerve.
Hypoglossal nerve.
Foramen magnum, they have lower end of the medulla oblongata, spinal root of the accessory nerve, vertebral artery, anterior posterior spinal artery,
Spinal.
arterial membrane, apical ligament. Again, the same thing. Foramen cecum. You just go through this picture. It will be easy now. This is all about this file. So we finish this file. From here you will get minimum 2 to 3 questions. Now, skull. Very basic. We know the bones, right? Name of the bones. Jugular foramen. Just now we have seen the content of the jugular foramen.
Pterygoid sinus, sigmoid sinus. Sorry,
Yes.
petrosal sinus, sigmoid sinus, and 9, 10, 11.
See, this is dangerous area of the scalp, emissary vein. Emissary vein, dangerous area of the scalp. This file actually, when I prepared, I studied this one with a lot of time.
So there is an old file and there is a final something
Yeah,
new file.
this is the
What's the
updated file.
difference?
Difference.
Okay.
This is most updated one
Okay.
based on MRCS, but that one was actually as like a textbook for head and neck.
Hmm.
So we will focus on this one. Already we have seen this is the beginning of the file, different
Hmm.
foramen and their location and the content.
Hmm.
Same. Now visual field defect. Visual
Hmm.
field defect. Visual field defect. Normally what happens with our eye when we see, if our every eye has two field. One is
Hmm.
temporal field,
Temporal
another
and
one is
nasal.
nasal. So both eye has temporal field and nasal field. Okay.
Hmm.
And when we get an image of any object in front of our eye, suppose something is here. So
Hmm.
we are getting reflection like this. Also from here
Hmm.
reflection going to this side.
Hmm.
Okay. Reflection coming a very little part. If it is crossing, depending on the position. If it is center, then it can cross. I mean, it can come in the both nasal field and temporal field. But if it is in
Yeah.
certain degree, it will not come into the nasal field because it will be blocked by our nose. Okay. When we get any image, it goes. If it is temporal field, temporal field come in the blue line. You can see temporal field coming like this way, and it is again going inside without crossing. Without crossing. Okay. Temporal field, both sides. Temporal field coming like this, and it is going like this. But if it is nasal, okay, nasal, my picture is very nasal. You can
Yeah.
see
It
nasal.
crosses.
It is
Hmm.
nasal light. It crosses the opposite side.
Hmm. Yeah.
Okay. See this side
Hmm.
nasal field. It is
Yeah.
coming and it is crossing to the opposite side. This right eye also nasal
Hmm.
field coming and it is crossing the opposite side. So there is a crossing
Opposite
only
side.
in the nasal field, but in the temporal field,
Hmm.
both side there is no crossing.
Hmm.
This crossing
Hmm.
area is called optic chiasma. Then the
Hmm.
extension optic tract. First we have retina where we have the
Optic tract.
reflection of the eye. Then we have optic nerve.
Hmm.
Optic nerve passes through which canal?
Optic canal.
Optic canal. Along with along
Ophthalmic artery and
ophthalmic
sympathetic
artery
fibers.
and optic nerve along with its three layers of the dura.
Sympathetic fiber.
Three layers of the dura.
Dura. Yeah.
Three layers of
Hmm.
the
Hmm.
dura.
Hmm.
Okay. And there is a crossing which is called optic chiasma. Okay, optic chiasma. Then we have optic tract. We have lateral geniculate body or nucleus, lateral geniculate nucleus. Then we have optic radiation, and then we have visual center. Okay,
Hmm.
this is the
Hmm.
normal
Hmm.
pathway. Normal pathway. Now visual field
Yeah.
defect, exam related visual field defect.
Hmm.
Left homonymous hemianopia means visual field defect of the left.
Hmm.
We will see this terminology only.
Hmm.
Bitemporal hemianopia. Bitemporal means both side temporal, right temporal, left temporal. Hemi means
Hmm.
half, and anopia means loss of vision.
Hmm.
Okay,
Hmm. Yeah.
so bitemporal, both side temporal field. Hemi means half, anopia
Hmm.
half, loss of
Hmm.
vision. If something is happened, problem is in optic chiasm.
Optic chiasma.
If
Yeah.
optic chiasma, this is optic chiasma here. If here there is any
Bitemporal
lesion,
hemianopia.
like a tumor, so what will happen? Light will come through here and it cannot cross to the opposite side. This side, nasal field. This is nasal field. Nasal field light will come and nasal field light actually crosses the opposite side, but temporal field light will never cross, right? Confused? You can see this is nasal field and this is temporal field, right? This is eye. Am I audible or no?
Yeah. Yeah.
Okay. So if nasal field, if because only nasal field crosses
The
to the
nasal fibers, they cross over at
if
optic
there is
chiasma.
any tumor or any lesion over this optic chiasma, then
They
both
will
sides,
not
this
cross over.
side also nasal field, this side also nasal field will not get.
Hmm.
See?
Hmm. Hmm. Okay.
If the lesion is before optic chiasma, monoocular vision loss, optic nerve
Optic
lesion,
nerve.
bitemporal hemianopia. This is fixed specific question
Optic chiasma.
comes like this. If there is bitemporal hemianopia, where is the lesion? Lesion in the optic chiasma.
Hmm.
Okay. Homonymous
Yeah.
hemianopia, an optic tract lesion. This is lesion after the optic chiasma. An upper quadrant hemianopia. This is a little difficult. Upper quadrant hemianopia. We have four quadrant like this. This is upper quadrant, lower quadrant. Upper quadrant hemianopia. This is temporal lobe lesion.
Lesion.
Mm, We will get another picture. Just in the beginning, we have seen Filatarsica. This or hypophyseal fossa. This is the location for pituitary gland, right? This is the location for pituitary gland, and this is the optic canal for optic nerve.
Yeah.
So optic nerve,
Yeah.
they form optic chiasma just over this. If there is any lesion in the pituitary gland, the optic nerve will be as like the roof, and pituitary gland is in the floor. So if there is any tumor in the floor, it cannot go down because lower part it is hard, bony structure, hypophyseal fossa. But in the upper part, as it is nerve, so optic tumor, pituitary tumor can compress over in the upper part. That's why if there is any tumor in the
Upper quadrant defect is more
upper
pronounced than the lower quadrant.
temporal lobe lesion, upper quadrant quadrantopenia, and parietal lobe lesion, lower quadrantopenia.
Inferior contralateral quadrantopia. Yeah.
Yes. Bitemporal hemianopia. Here we have this expansion. Lesion of the optic chiasma. Upper quadrant defect. Upper quadrant defect is more than the lower quadrant. Upper quadrant defect is more than the lower quadrant. Then it means inferior chiasmal compression. Commonly in pituitary tumor. If there is any pituitary tumor, it can compress, and there will be upper quadrant defect more than the lower quadrant defect. But if craniopharyngioma, if it compresses from the upper part, craniopharyngioma, it is tumor of the upper part, then it will give pressure from the superior surface, superior chiasmal compression, and commonly it is common in craniopharyngioma, and patient will have lower quadrant defect more than the upper quadrant. This head and neck is quite difficult. We have to read multiple times. Okay. Now pathway of CSF. This is a simple CSF pathway. CSF picture is not very clear, but we can remember. CSF first it comes from the lateral ventricle to third ventricle.
Third, then fourth. Yeah.
Lateral ventricle to
To
third
third
ventricle.
ventricle.
Suppose this is third ventricle. Lateral to third ventricle. How? They come through foramen of
Foramen
Monro.
of Monro.
So lateral ventricle to third ventricle through foramen of Monro. Then from third ventricle they go to fourth ventricle. Suppose this is fourth ventricle. This is only for understanding, not the exact picture. This is third ventricle. This is lateral ventricle. Lateral ventricle to third ventricle through foramen Monro.
Monro.
From third
Monro.
ventricle to fourth ventricle, they come through
Aqueduct of Sylvius.
aqueduct of Sylvius. Now from the fourth ventricle, they go to
Majendi and Lashka.
They have like this lateral and central. They have one central, and two lateral. Okay, Lashka is lateral. Foramen, Lashka is lateral, and foramen Majendi is for middle. And Majendi is one, Lashka is two. And then they reach in the subarachnoid space of the brain and the spinal cord, and then from there subarachnoid space again it is reabsorbed to venous sinuses and then circulate in the brain. So again, any one of you can repeat CSF pathway.
Yeah. So the CSF basically flows from the lateral to the third ventricle via foramen of Monro, and then from third to fourth via aqueduct of Sylvius, and then from the fourth it goes to the two lateral Lashka.
It goes to subarachnoid space through
the subarachnoid space of the brain and the spinal cord via foramen of Majendi, which is medial, and Lashka, which is lateral, and then reabsorption into the venous sinuses.
Subarachnoid space. And from here it is reabsorbed into venous sinus. Now cranial venous sinus. Cranial venous sinus. We just need to have the orientation. No need to remember everything. This is part B. MRCS part B question. We have to show different sinuses. Just see very simply. This is the superior surface. So here we have superior, and this is sagittal. Superior sagittal sinus. Okay. If there is anything superior, we have the same structure inferior. So
inferior
sagittal sinus just below, you can see this is inferior sagittal sinus. Inferior sagittal sinus. Two sinus we got. Then superior sagittal sinus coming posteriorly, and from both sides we have transverse because they are anatomical location. See, these are transverse sinus. Both transverse sinus and superior sagittal sinus, they all are joining together, and this joining point is called confluence of sinus.
Confluence of sinuses.
Yes, confluence of sinuses. Then from there will be straight forward one sinus. It is called straight sinus. Okay, we have straight sinus. From the confluence of sinus, one going straight forward, which is called straight sinus. From straight sinus, we have great cerebral vein. Great cerebral vein, no need to remember now, just remember up to here. So we have superior sagittal sinus, inferior sagittal sinus, transverse sinus, and confluence of sinus, straight sinus. Once again, you can see this is superior sagittal sinus coming posteriorly. Then we have this is transverse sinus.
Uh,
Transverse sinus
mm,
joining to here in the confluence of sinus. Then from here we have one straight forward, little upward, straight, little upward. This is straight sinus. Okay, sinus rectus.
okay.
These
I
names are
I
little
have a
like
conclusion.
Italian.
Yeah. What I think is that I think we can double check as well that the inferior sagittal sinus, it joins the cerebral veins, the great cerebral vein, to form the straight sinus, and
It,
then that drains into the confluence of the sinuses.
see their direction. You remember we said earlier that artery we say branches. Suppose subclavian artery
Mm,
branch of these. Then, but venous when we describe about the vein, we describe as like drainage, venous drainage. This superior sagittal uh, sinus drain into. It is not formed by. It is
okay.
drain. See their direction. As like you are right. Inferior sagittal sinus, they are actually see their flow. It is coming
Mm,
backward.
mm,
Okay.
mm,
From here we will not get any question, just to get the conception
mm,
how the sinuses are located in your brain.
mm.
This is exam question. Cavernous sinus. Very
Okay.
important. Here is the cavernous sinus.
Okay.
Cavernous sinus. Both sides we have cavernous sinus, right and left side.
Mm,
Cavernous sinus are the paired because right side also we have, left side also we have, and it is located in the sphenoid bone. In cavernous sinus,
mm.
you remember superior orbital fissure. Content of superior
Yeah.
orbital fissure we had 3, 4, 6. They are fallen. 3, 4, 6 superior and inferior branches. Also,
Mm. Of
we
the oculomotor.
we have 5 V1. This V1 we had fallen. FLN. Frontal lacrimal and
Frontal,
nasociliary
lacrimal,
branches of the
nasociliary.
ophthalmic nerve.
V1.
Op-
Mm,
mhm. Ophthalmic division of the trigeminal nerve, frontal lacrimal and nasociliary division.
mm,
And we have superior and inferior branches of the
mm,
third, fourth and sixth nerve. Same, almost like the same.
mm,
Cavernous sinus, they
mm,
contain third, fourth and sixth.
mm.
But here, exception in superior orbital fissure, we had only V1. But here we have V1 and V2. This is the difference. Okay,
Okay.
so it is divided into two components. One, you can see like this. This is the lateral. This is pituitary gland or hypophysis fossa. So this is medial side.
Okay.
They have medial wall
Okay.
and lateral wall. Lateral wall component, we can see we have oculomotor
3,
nerve,
4, 6.
then
V1,
trochlear
V2.
nerve, abducens nerve. Sorry, abducens nerve. It is last. I mean, the senior one among them. Senior ones in the sense it is number 6. Okay, so senior one
Mm,
will remain medial. I remember that. The senior person gets more priority. Okay, so abducens being number 6, it gets more priority, so it remains inside medial one, and others they are like the junior, so 3, 4, 5, 1, 5, 2 all remain in the lateral one,
okay.
and in the medial wall only two things. One is internal carotid artery, and we have abducens nerve. So here you can see lateral wall component: oculomotor nerve, trochlear nerve, ophthalmic nerve, and maxillary nerve. V1 is ophthalmic and V2 is maxillary, right? And content of the sinus. See, content of the lateral wall. If they ask content of the lateral wall, we will say this. And content of the sinus. These all are actually the content of the sinus, but sometimes in question they consider only these two are the content, which remains in the medial wall. So medial wall mainly the content of the sinus. Only two things: internal carotid
Okay.
artery and
The
abducens.
artery and sixth. Yeah. Okay.
So this is again, this is internal carotid artery and cavernous. This is cavernous sinus. So with internal carotid artery we have senior nerve, which is abducens 6, and remaining the junior 3, 4, 5, 1, 5, 2 remain in the lateral wall.
Hmm.
Now you can see this is superior ophthalmic vein, inferior ophthalmic vein. They are draining into, draining into cavernous sinus. They are draining into cavernous.
Cavernous sinus.
And from there we have superior petrosal sinus, and we have inferior petrosal sinus. Superior petrosal sinus, inferior petrosal sinus. Then we have sigmoid sinus. We will see one by one.
Hmm. So superior and inferior ophthalmic vein they drain into the cavernous sinus, and then from there the inferior and the greater petrosal.
Yeah,
Then they drain into the dural venous sinuses, isn't it?
yeah.
The transverse sinus and the okay. So that's how the
Transverse
sinus
sinus.
thrombosis
Mm-hmm. Transverse sinus
the
will
infection
mm,
can
transverse
spread.
sinus comes like this anterior. Then it will join there. We have another picture.
Hmm.
Then we will see this all venous sinuses.
Hmm.
This is a easy one, comparatively easy. Sternocleidomastoid. This is a muscle, and this is called, okay, this is mastoid process. Okay, and this is the clavicle. As this muscle joined from clavicle to mastoid, and sternum also. So this is sternum, clavicle, and mastoid. So name is sternocleidomastoid. This is very important because it divides the neck triangle into different components. The part anterior to
Hmm.
it is called anterior triangle. Part behind it is called posterior triangle. Okay.
Hmm.
So sternocleidomastoid, their origin, upper manubrium sterni, muscle head attached to the medial third of the clavicle. Okay, so manubrium sterni and medial third of the clavicle, and insertion in the mastoid process of the temporal bone.
Temporal bone.
Innervation by
Okay.
spinal part of the accessory nerve and anterior rami of C2 and C3. Mainly accessory nerve. Sternocleidomastoid is supplied by the accessory nerve, and their action, when single, means only right side sternocleidomastoid act, then they cause lateral flexion of the neck and rotate.
Hmm.
So face looks upward to the opposite side. No need, just lateral flexion of the neck. If it's single sternocleidoid, lateral flexion of the neck. If both,
Lateral flexion of the neck.
they extend the head. If both right and left,
Hmm.
both sternocleidoid, then they
Hmm.
extend the head at atlanto-occipital
Hmm.
joint and flex the cervical
Hmm.
vertebral column. And
Yes.
I was waiting for this. This is called accessory muscle of inspiration. This is exam question.
Yes.
Accessory muscle of inspiration, not expiration. Inspiration. Inspiration.
Hmm. Hmm. Uh, it has there was a triple S, isn't it? The accessory muscle, serratus anterior, sternocleidomastoid, and there was a third S as well. There was three S I remember.
Where? Which one?
The accessory muscles of the respiration, of the inspiration.
Sternocleidomastoid, serratus anterior.
Serratus anterior.
Another one is your homework.
Yeah.
Okay.
Oh, scalene, I think so.
Scalenus, okay. Scalenus has three. Scalenus anterior, scalenus posterior, and in between medius. So scalenus anterior,
Intermediate.
it joined with the first rib. Scalenus posterior joined with the second rib. Okay.
Hmm.
Elevate. Second, scalenus medius and posterior, they join with the second rib. Hmm. Hmm. Again, scalenus anterior elevate the first rib.
Hmm.
Medius, same action as anterior. So scalenus anterior and medius, they elevate the first rib.
They elevate the first rib.
Scalenus posterior,
Okay.
they elevate the second rib. Then
Hmm.
innervation by spinal nerve
Spinal nerves.
to 4 to 6, and their important relation. This is important, exam related. Brachial plexus and subclavian artery. Brachial plexus, BP, and subclavian artery. Brachial plexus actually the nerve, right? And
Hmm.
subclavian
Yeah.
artery is the artery. So they pass
Yeah.
between the anterior and middle scalenus. This is anterior,
Hmm.
anterior, and this is scalenus medius. And last one
Hmm.
is scalenus posterior. Scalenus anterior and
Posterior.
medius, they are attached with the first rib, attached with the first rib, and scalenus po- uh, posterior attached with the second rib. So
Hmm.
subclavian vein remain anterior to scalenus uh, anterior. Subclavian vein remain
Okay.
anterior, anterior,
Remains anterior
anterior.
to the scalene
Scalenus,
anterior.
scalenus
Okay.
anterior, anterior, and
Okay.
scalenus anterior and scalenus medius. In between this, we have subclavian artery,
Brachial plexus and
brachial plexus.
subclavian artery. Hmm.
Okay.
Hmm.
Again, here we can see nicely. This is subclavian artery, and with subclavian artery, we have brachial plexus. It is posterior to scalenus anterior and anterior to scalenus medius.
Yes.
Subclavian vein and phrenic nerve passes anterior to the scalenus, anterior scalenus, as it crosses over the first rib. Okay.
Hmm. Hmm.
Thoracic
Hmm.
symptom. The scalenus are at a risk of adherent to the pressure. Okay. Compression of the brachial plexus when passes between the clavicle and the first rib, causing thoracic outlet syndrome. Compression of the
Okay.
brachial plexus when it passes between the clavicle. This is first rib. It is coming here, and here we have sternum, and in the sternum we have
Hmm.
sternal head of the clavicle, right?
Hmm.
Clavicle attached with the
Hmm.
sternum. So
Hmm.
if brachial plexus passes between the clavicle and the first rib, then there
Hmm.
could be compression, and it is called thoracic outlet syndrome.
Hmm. Hmm.
Anterior triangle of the neck. This is important. Anterior triangle of the neck, already we got a little idea that the neck,
Sternocleidomastoid divides the two muscles,
if this is neck,
the two
if this is
triangles.
sternocleidomastoid, it is dividing anterior triangle and this is posterior triangle. Now anterior triangle of the neck, boundary, anterior border of the, this is, if this is sternocleidomastoid, boundary, anterior border of the sternocleidomastoid, lower border of the
Hmm.
mandible here, lower border of the mandible,
Mandible.
and this is the
Hmm.
midline.
Hmm.
Here you can see this is lower border of the mandible, anterior border of the sternocleidomastoid, and this is anterior midline. This part is the anterior triangle of the
Anterior triangle.
So anterior triangle of the neck, we have right side and left side both. Now
Okay.
sub triangles or anterior triangle again divided by two muscles. One is digestic muscle, another one is omohyoid. Digestic muscle and omohyoid muscle.
Hmm.
This is picture. Head and neck is the toughest topic of whole anatomy. So you have to be mentally prepared. It will be difficult. And for me, I studied this book first. I mean this textbook one. Whole book I finished. Then I got that file. Then again another chapter started. But it was good to read that book before.
Hmm. Hmm.
Something happened on my screen. I think we can conclude here today. Okay, mainly you focus on skull, foramen, their content, and then up to anterior triangle of the neck.
Okay.
Okay. So
Are we going to have a lecture tomorrow as well?
yeah, we will discuss this head and neck. It will take 3 days.
Yes.
No need to
Yeah.
rush, because if we understand the lecture properly, MRCS will be easy.
Yeah. Yeah.
Uh, okay, just it is working again. We can see it easily. Anterior triangle of the neck
Anterior triangle.
again divided into 3 subgroups by 2 muscles. Okay, one is digestic muscle, superiorly by digestic muscle, and inferiorly by omohyoid muscle. Okay, digestic muscle, it is like a loop. Just think about the rope. A rope starting like this, and it is hanging here. This is a rope,
Hmm.
and
Digastric. So.
here also another. It is pulling it downward. See, nicely now it became 3 part. 3 part.
Yeah,
One,
digastric and
2, 3. So one, this is omohyoid, and omohyoid, they have anterior belly and they have posterior belly. And here this junction, from this junction again, omohyoid hanging down, and they have a
yeah.
superior belly, and in between there is a partition like this. They have inferior belly. So mainly in anterior triangle, we have superior belly of omohyoid, and inferior belly of omohyoid, this is the inferior belly, we will get it in posterior triangle. So again, anterior triangle of the neck, again subdivided by 3 subgroups by 2 muscle, anterior
Two
belly
muscles.
by digestic muscle
And
and
of the
omohyoid.
digastric muscle and the omohyoid.
Digestic has anterior belly from here to here, and they have posterior belly. This is posterior belly of digestic. this is posterior belly.
Hmm.
And here they have a junction. This junction coming down by the muscle
As the
omohyoid.
omohyoid.
This is superior belly, and in the posterior triangle we have inferior belly.
Hmm.
So we have one triangle. This is just below the mandible. That's why it is submandibular triangle. Then we have here, which is mainly in the carotid sheath. Carotid sheath
Call
only.
it carotid triangle.
This is carotid triangle.
Hmm.
And anteriorly, we have many muscle here. This is called muscular triangle. So digest submandibular triangle, carotid triangle, and muscular triangle.
Muscular triangle. Okay.
Now here is the boundary and their subdivision by digestic and comohyoid. সরি ভাইয়া, আপনি স্টার্ট করছেন একটা বোরিং লেকচার দিয়ে। সরি ভাইয়া। ভাইয়া আজকে তো বেশ রাত হয়ে গেছে, আমরা আজকে এতটুক রাখবো, কারণ আপনারও ওখানে বেশ রাত হয়ে গেছে। আমরা আজকে এতটুক রাখবো, কারণ আপনারও ওখানে বেশ রাত হয়ে গেছে। ভাইয়া একটা ওই ছোট একটা গ্রুপ আছে, এই যে দুজন ডাক্তার